Okay, in this video we're talking kinesiology. So we're studying the movements at synovial joints. Um, there's some terminology, and you can, define these terms is great, but you really want to practice them. All right. So all these drawings are trying to represent the different movements, but once we're done with this video and done with the next video, the best way to learn movements is to just do them, right? We've got all these joints, you've got them. Uh, do it in the mirror so you can see yourself doing them, or just practice these, because knowing what flexion means in one joint is great, but you kind of want to know what that means in more than just one joint. Okay, so the first set of movements are flexion and extension. So by definition, a flexion is when the angle between the two bones decreases. All right. Extension is when the angle increases. So the best example to start with is your elbow. I think that's the one that we all know that, when someone says, go ahead, flex, you take that elbow joint and you decrease the angle. All right. So when your arm is straight, when that elbow joint is straight, that angle is 180 degrees. All right. That's a straight angle right here. So when you move that forearm this way, that angle is decreasing. So here the angle is maybe, I don't know, 45 degrees. All right. So moving this way is flexion. Moving back this way, straightening that arm out, is extension. So that's kind of the easiest one, your elbow. But what else can flex and extend? Your head can flex and extend. So when you're looking straight ahead, the angle between your head and, say, your chest is 180. So when you look down, that's flexing because you just decrease that angle. And then when you look up, you're extending. Okay, so flexion looks down, extension you look up. Let's look at another one here, your wrist. So you can flex your wrist and extend your wrist. So the angle, right, when your hand is straight, it's 180. When you bend it this way, you're flexing. When you bend it the opposite way, you're extending. All right. Knee joint flexes and extends. So when it's straight, right, it's extended. When you bend your knee, you're flexing it. And then when you straighten it back out, you're extending it, extension. All right. What else can you flex and extend? The trickiest is your shoulder. All right. So when your arm is straight down along the side of your body, it is at a 180 degrees with your head. All right. So when you move your arm this way at the shoulder joint, that's called flexion. When you move your arm back, that's extension. That's the one students struggle the most with. All right, is flexion and extension at the shoulder joint. Okay. What else can you flex and extend? You could flex and extend at your torso, basically. So when you bend down to maybe tie your shoes, you're flexing, and then you straighten back up, you're extending. Hyperextension is beyond that normal 180 degrees. So some body parts, some joints will allow hyperextension, right? So when you bend way back like this woman is here, that's hyperextension, and that's okay to a certain point. You don't want to hyperextend an elbow. You don't want to hyperextend a knee. So some joints will allow that little extra extension, but some joints definitely do not. Okay. All right, so that's flexion extension. I would practice each one of these images and better understand why we're calling it flexion. Every time you flex, you want to think, okay, is the angle decreasing? And then when I extend, is that angle increasing? The next two are abduction and adduction. So abduction, with a B, the body part is moving away from the rest of the body. All right. Adduction, with two D's, that body part is moving back towards the body. I always mention, when someone is abducted, right, they're taken away. All right. So when you take a body part away, it's abducting. When you bring it back, it's adducting. So this is abduction and adduction at the shoulder joint. All right. You can abduct and adduct at the hip joint. So moving that leg away is abduction. Moving it back in is adduction. You can abduct and adduct your wrist. All right. So remember, if we're looking at this hand here, all right, this is lateral. The thumb is lateral. So if you move that wrist that way, you're moving it away from the body. If you're moving that hand this way, you're moving it back in towards the body, so that's adduction. So that's at the wrist. You can abduct and adduct your individual fingers. So when you spread them apart like this, they're moving away from the midline of the hand. Whereas if you're moving them back in, you're adducting. All right, there's that shoulder again, abduction, adduction. There's the fingers again, abduction and adduction. So practice these. Practice abducting and adducting at different joints. Notice what joints aren't on here. Hinges. Hinges do not like to abduct or adduct. You don't want to do that at the elbow. You don't want to do that at the knee. Next one is rotation. So rotation requires either a pivot joint or a ball and socket joint. All right, so this woman is rotating her head using her atlantoaxial pivot joint. All right, that pivot joint between C1 and C2. When you turn your leg like this, you can move it, you can rotate it away. It's called lateral rotation. So notice that foot's out here. When you rotate it inward, that's medial rotation. So that's using the ball and socket hip joint. You can also do that at the elbow, or the shoulder joint. So when you move that arm away like this, you're turning it, you're rotating it away. That's lateral rotation. When you're rotating it back in, that's medial rotation. All right. I don't like these arrows because this arrow means that you're kind of going from this situation to this situation, which would be lateral. When you're going from this position back to this position, it's medial rotation. So practice rotating your head side to side. Practice rotating your leg. Practice rotating your arm. When we rotate our palm, we have specific words for that. That's known as pronation and supination. So pronation and supination is a type of rotation, but those are specific to the hand, the palm of the hand. And this is done not at the wrist. This is done at that proximal radio-ulnar joint. All right? So pronation is when you turn your palms posterior. All right? So when you go from this position to this position, that's pronation. When you're going from this position to this position, that's supination. All right? So pronation is palms down or palms posterior. Supination is palms anterior or palms up. Okay? And some people like to remember, when you beg for soup, you're supinating the hand. So if you're like putting your hand out asking for, soup or money, that's supination. All right? So remember, this is rotating the hand, but it's done at the proximal radio-ulnar joint. All right, what's the next movement? Circumduction is basically moving. Typically, we're looking at a limb in a circle. So circumduction is not rotation. It's moving that limb in a circle, your circular or cone-shaped motion. And circumduction is really a combination of flexing, abducting, extending, adducting. You're kind of doing all those in order. All right, so circumduction can be done at ball and sockets, the hip and shoulder. Finally, we have some special movements that are, specific to either the foot, and then we'll get to some other ones. But when you dorsiflex at the ankle, you're lifting your foot off the ground, leaving the heel on the ground. All right, so when you leave your heel on the ground and just lift that foot up off the ground, that's called dorsiflexion. All right, you're flexing towards the dorsal surface. This is the dorsal surface of your foot. The bottom of your foot is the plantar surface. So when you move that foot down, say for example you're standing up on your tippy toes, that's called plantar flexion. All right, and then this is just another picture kind of showing that. Dorsiflexion, plantar flexion. You can also invert and evert a foot. I kind of prefer this picture here, but when you lift that foot up and kind of face it inward, that's called inversion. When you take the sole of your foot and kind of face it outward, that's eversion. All right, so these are specific to feet. These are movements of the feet. We can protract and retract different body parts. This shows your mandible. Moving the mandible forward or anterior is protraction. Moving it backwards or posterior is retraction. You can also protract and retract your scapula. You can move that shoulder blade forward and backwards. When the mandible moves side to side, we call that lateral excursion. So you can kind of slide your mandible to the right and slide it over to the left. Elevation and depression. That's kind of easy. When a body part moves up, it's called elevation. When it moves down, it's depression. You can do that with your mandible, right? If you elevate your mandible, you're moving it up, and then you can depress the mandible. You can also elevate and depress your scapula. So when you shrug your shoulders, you're moving that scapula kind of up and down. And then finally, we've got some other things with our thumb. So we can do opposition and reposition. So opposition is when you move that thumb over and you can touch your pinky. And then when you move it back, it's called reposition. So those were different movements. We're going to end that video. So that video was basically our kinesiology, just an overview of all the different motions at particular joints. And then the third video, we're going to focus in on the big three. And we're going to take a really close look at the structures at each of these joints. And we're going to kind of classify the joint and learn what kind of motion occurs at these joints.